Hello everyone, and welcome to our virtual educational program. In this video, we will be presenting an overview of strokes. A stroke is a brain injury that occurs because the brain's blood supply is interrupted. Strokes can be classified in two principal ways. They can be classified based on the cause or based on the location. Let's first discuss the two causes of a stroke. First, a hemorrhagic stroke happens when a blood vessel can leak or burst, so that the blood spills around the brain tissue. When the hemorrhage occurs in the brain, it is called an intracerebral hemorrhage. This type of stroke is often linked to high blood pressure, old age, heavy alcohol use, and use of cocaine or methamphetamines. When the hemorrhage occurs between the brain and the skull, it is called a subarachnoid hemorrhage. Hemorrhagic strokes are much less common than strokes caused by clots, which are the second type of strokes called ischemic strokes. These can be further subcategorized into thrombotic and embolic. A thrombotic stroke, which happens when a clot, or thrombus, forms inside one of the brain's arteries. As such, it blocks the blood flow. This usually occurs inside an artery that has already been narrowed by atherosclerosis, which is a buildup of fatty deposits along the walls of blood vessels. Thrombotic strokes are the most common type of stroke, as they account for almost half of all strokes. Lastly, an embolic stroke, which occurs when a blood clot or other solid mass travels to the brain, where it blocks an artery. Another relevant classification of stroke is the location of the injury, whether in the right or left hemisphere of the brain. Strokes that occur in the left hemisphere can affect communication and memory, as well as movement on the right side of the body. On the other hand, strokes that occur on the right side of the brain can affect spatial and perceptual abilities, as well as movement on the left side of the body. Who do strokes usually happen to? Anyone can have a stroke, but some things put people at higher risk, and some things can even lower the risk of having a stroke. If you are 55 years or older, if you are African American, if you are a man, or if you have a family history of strokes or heart attacks, your chances of having a stroke are higher. Being overweight, physically inactive, drinking alcohol heavily, recreational drug use, being a smoker, having high blood pressure or cholesterol, having uncontrolled diabetes, suffering from obstructive sleep apnea, or having certain forms of heart disease are risk factors as well. What are the symptoms of stroke? Look for these signs and symptoms if you think you or someone you know is having a stroke. Trouble speaking and understanding what others are saying. Paralysis or numbness of the face, arm, or leg on one side of the body. Problems seeing in one or both eyes, or sudden deviation of eyes toward one direction. Trouble walking and loss of balance. Additional symptoms of stroke are dizziness or confusion. Coordination problems in the arms and hands. Many strokes are not associated with a headache. However, a sudden and severe headache can sometimes occur. How is a stroke treated? Once the medical team can determine the type of stroke, they can determine the treatment too. If one is having an ischemic stroke, it is important to restore blood flow to the brain as quickly as possible, providing the oxygen and other nutrients to the brain, which the brain cells need to survive. This can be done by an intravenous medicine, which dissolves the clot obstructing the blood flow. Otherwise, the medical team may perform an emergency endovascular procedure. This involves advancing a plastic tube, called a catheter, up into the brain arteries, allowing the blockage in the artery to be removed directly. Unlike ischemic strokes, the goal for hemorrhagic strokes is to control the bleeding and reduce pressure in the brain. This can be done by blood pressure medications, which reduces the blood pressure and prevents seizures. If the bleeding is severe, surgery may be performed to remove the blood in the brain. Everyday life. It is normal for people to feel sad or even depressed after suffering a stroke. Depending on how severe the stroke was, it can have an enormous impact on an individual's life. People who used to live independently may now need to rely on others, such as their spouses or children, for help in everyday activities. Rehabilitation treatments such as occupational therapy, physical therapy, and speech therapy, as well as modifications of activities, can help people recover and regain some of their independence. However, it is important to remember that every stroke is different, and therefore every person's road to recovery is different. Some people may have a full recovery, while others will have slight, moderate, or severe disabilities. Regardless of the category or severity of stroke, for most people, recovery involves a lot of work, and most of all, a lot of time. Caregiving for someone with a stroke is challenging, as behavior, memory, communication, and physical capabilities can all be impacted by stroke. When a loved one is first hospitalized after a stroke, family members, including spouses, parents, or children, suddenly become the individual's voice and chief advocate. Consequently, as treatment progresses, you, as the primary caregiver, also may be involved in the rehabilitation process, coordination of home care services, provision of transportation, housekeeping, and cooking, and communication with physicians and healthcare providers. Although providing care for a loved one may feel all-consuming, it is important to remain aware of your own health and the ways any resulting stress may be affecting you and your well-being. For a helpful guide by the American Stroke Association created for caregivers of individuals who suffered a stroke, please check out our additional resources. Thank you for your attention during this presentation. We hope the information provided was helpful to you.